So I just finished up residency at Boston Medical Center, and Boston Medical Center is a big safety net hospital. So we took care of a lot of patients who spoke different languages and had different educational backgrounds. And in that setting, over the past year or two, we started implementing cellular therapies more and more in the inpatient setting. So we as residents started to notice that patients in whom we were concerned about neurotoxicity, a lot of those patients were non-native English speakers, or maybe some of those patients had a mild cognitive impairment at baseline. So that made us think, how do we measure neurotoxicity in patients receiving cellular therapies when maybe they don't fit the textbook? So we thought maybe there was a need to come up with a slightly modified way of measuring our neurotoxicity scores, our ICE score. Maybe there could be an adapted metric for people who don't speak English as their first language, for patients who have cognitive impairment, who may have educational backgrounds that are different from what we traditionally consider to be normal. And it just felt like a fixable problem. So in order to do this, we did a survey on nurses, staff members, residents, faculty, and we tried to see what people thought about how accurate our current neurotoxicity standard, the ICE score, was in our particular patient population. And scarily, a lot of people, the majority, 92% of our survey participants, thought that our current metric, our ICE score, often resulted in harmful interventions for patients, particularly those who don't speak English as their first language. So based on this, we were inspired to come up with a modified metric, a non-native English speaker ICE score, or a NICE score. And we worked with some neurologists to make sure that we were measuring the same cognitive domains. So now, based on our survey, based on the need for this, we're hoping to validate our new metric, our NICE score, hopefully in a larger population.